Healthy People really is a set of national objectives that represents the health of the nation as a whole. For Healthy People 2030, we've really moved from health alone to health and well-being, reflecting the idea that how people think, feel, function, both at an individual and social level, and how they evaluate their lives as a whole, is really an important next step in the evolution of this program as it's going into its 5th decade.
Well, employers and businesses are an incredible part of our economy, and the employees themselves are a major part of our population. So our Healthy People initiative would be enhanced incredibly with the involvement of employers as partners, as stakeholders. We have a commitment to the past successes in Healthy People over the last 40 years, where the input and support needs to come from the diverse set of sectors, and businesses are essential.
There are many opportunities for businesses and other sectors to participate in Healthy People 2030. We've broken down our implementation plan by pre-launch, launch, and post-launch, and at each phase there's a key role for business. Once we have the indicators, there's a way that the businesses can both incorporate them in their strategic planning, and as well they can help disseminate them through their various employee mechanisms. And very importantly, HERO can play a key role in getting it out to all of the businesses that are members of HERO. We also think that there's a developmental role. There are certain indicators that employers are using and data that they're using that can help inform Healthy People 2030 as they look at new developmental objectives going into the future. So at all phases, there's an opportunity for business to be involved.
Our health and well-being really starts at the grassroots, in your backyard, in your community. And what we have said in our implementation plan, that we encourage individuals, communities, states, tribes to identify and adapt objectives in Healthy People, which are set for the nation, to the local needs and interests. And by doing that, we feel that the local endeavors and their work at that level is critical, both in their getting data that they need to do their job, but also in building the benefits of the progress they're making locally into the national progress for health and well-being.
Businesses can sort of look towards Healthy People 2030 at the national level by sort of reviewing what is it that applies, what makes sense. So for example, if objectives indicate that it's a goal across the country to initiate nutrition and healthy eating programs or physical activity programs at the workplace, tobacco cessation programs at the workplace, all of those are easily sort of integrated into what a specific company can do to support the health and well-being of their workforce. But it doesn't need to be a specific program, let's say nutrition related, that follows guidelines that is specific to, let's say, dietetics or dietitians on site. But it could also be something creative that says, let's bring an opportunity for our workers to have a vegetable garden at the workplace, to do those kinds of things that are a little bit more out of the norm, but they fit with those kind of objectives. And then thinking about, as individual workplaces create their programs, what is sort of the line of sight to the objectives as a whole? So if nutrition and physical activity is important at the individual worker level, what does it do to how people feel? How does it flow into their family? And how does how do those kinds of initiatives flow from families into neighborhoods and into community levels? So it really is sort of thinking through how can we use these federal objectives to stimulate local action by just basically making them part of the strategic plan at the level of the workplace.
Our goal is to have these Healthy People 2030 objectives adopted broadly, not just by technical public health people, but the broad community. And the only way we can do that is to both make them valid and relevant, but also to make them fun. And so we anticipate that there will be opportunities to include some of these objectives into games that kids can play about how to be healthier, games that can be adopted by businesses for their employees. We also anticipate that there can be some challenges because we know that this is a competitive society that we have and everybody wants to do better than their neighbor. So if there were challenges on one state or another having a higher rate of meeting the objectives, or it could be one corporate sector versus another, we just think it's unbounded by ways that we might have thought about these goals as being something that are government specific, carried out by local health departments. That's really not the way we're envisioning these Healthy People 2030 goals and objectives. So we want them to be fun and we want them to be implemented more broadly so that we are truly having them as a strategy for the nation.
So there's a variety of ways that we believe people can get involved, not just actually people, but also organizations and also Hero. Hero could actually be a facilitator of bringing stakeholders together to think about how, for example, data partnerships could be designed or ways to bring data from companies to the table in a way that is certainly protecting the privacy of the individuals, but data that allows you to sort of start making those connections to the national objectives. At the same time, when people want to be involved, early on, they can also always provide comments. You can go on the website, healthypeople.gov, or you can just put it in a search engine and be able to sort of review everything that has been made public to anybody in the country. So all of our reports are available there to review, to provide comment on, and to participate in that process.
And going back to the theme of fun, we wanted to make sure that the website was not only full of reports and data that people could pull up, but there were interactive ways that they could participate with the Healthy People objectives. And as well, there is a framework that's been developed for an interactive model. So they can see what we're trying to achieve, and then it can take them to the different objectives based on the theme or the issue that they're most interested in. So we want to make sure that it's really easy for people to engage in the Healthy People 2030 data.
So as an individual, obviously coming to the website is a place to go because it will link you to other health-related information and it would be all vetted and evidence-based information, so they could use that. They could also be led to programs that are in place geographically in their backyard or somewhere else. A lot of these objectives are linked into existing state health improvement processes that are up on webs in every state and are downloaded in the counties and the towns where people live. So it's a natural umbilical cord to your personal interests, your family's interest, and also what the community wants.
I think one last point to make is that these are the nation's goals for the health of everyone. And we should hold government accountable for helping achieve those goals. So if you don't have the local communities and the businesses engaged in the process all along the way, then it's hard to say that we haven't met the goals, because it's up to us to make sure that there's an accountability and to provide feedback. So I'm hoping everyone will find this a useful tool, the website, and that they find that it is valuable for their own business.